Talking about the anteromedial aspect of the thigh, it cannot be completed and it cannot be, we can say, summarized without mentioning the adductor canal, because it is actually the anatomical structure through which the veins, arteries, and nerves pass in this region, and thus perhaps it is very important to discuss it. So in this part of the lecture, we are going to talk about the adductor canal as well as the adductor hiatus and the structure of the adductor canal and the boundaries as well as the contents of the adductor canal. So let's start off with the adductor hiatus because it is important to understand what adductor hiatus is so that we can move on to the adductor canal. So adductor hiatus is actually a gap between the adductor magnus muscle and the femur. So to visualize this, let's take a look at these two pictures. Here we can see this one is the adductor brevis. This one here is the adductor longus. And this one here is the adductor magnus. If we remove these two, we can see that this whole muscle is the adductor magnus. So when it attaches to the tibia and to the complete or the whole of the linea aspera as well as the adductor tubercle, so somewhere on the lower distal aspect of the femur, it actually leaves a gap, and that gap is actually known as the adductor hiatus, and that is actually the end point of the end of the adductor canal. So the adductor hiatus actually allows a passage of femoral vessels, including both arteries and veins, and as well as the nerves, from anterior to posterior thigh and into the popliteal fossa. And as I already mentioned, it's also the end point or the termination of the adductor canal. Now, in order to understand the adductor canal, it is sometimes also known as subsartorial canal as well as Hunter's canal. And it is actually an aponeurotic tunnel in the middle third of the thigh through which the vessels, including the arteries, nerves, and arteries, veins, and nerves pass. And here we can see in this picture here, this is actually the adductor canal, and we can see that the veins, arteries, and nerves are passing through it, and it is actually surrounded by the adductor magnus, sartorius, and vastus medialis, and they actually form a canal through which different structures are passing. So it extends from the apex of the femoral triangle to the adductor hiatus. So we can say that the start of the adductor canal is from the femoral triangle and the end of the adductor canal is at the adductor hiatus. Now, talking about the structure of the adductor canal, it is actually an intramuscular cleft or an empty space between the muscles, and on the medial aspect of the middle third of the thigh, on anterior compartment of the thigh, allowing the passage of veins, arteries, and nerves through this region from the anterior aspect to the posterior aspect and thus eventually into the popliteal fossa. So the boundaries include the anteromedial wall, which is formed by the sartorius, the posterior wall, which is formed by the adductor longus and majorly the adductor magnus, and the laterally it is surrounded by the vastus medialis. As you can see in this picture here, these are actually the structures passing here. So we are going to take a good look here at this. So we can see that here we have the nerves, arteries, and veins passing through the adductor canal. And here laterally we have the adductor longus and adductor magnus, on the posterior aspect, and this is the lateral aspect where we have the vastus medialis, and here we have the anterior aspect which is the sartorius. So this here is the anterior aspect and this is the posterior, this is the medial, and this is the lateral. So here we have the adductor magnus and the adductor longus and adductor brevis. So they are actually making the posterior part of the adductor canal, as already mentioned, the sartorius making the anterior part of the canal, and vastus medialis making the lateral part of the canal, because this is the lateral aspect and this is the medial aspect. So the contents of the adductor canal include the superficial femoral artery, the femoral vein, the bundles of the femoral nerve, the saphenous nerve, and the nerve to the vastus medialis. So these are all the structures which are actually contained within the adductor canal, as we can see in this picture as well. This is the femoral vein, this is the femur, because this is the lateral aspect, this is the medial aspect. So this is the femoral vein, this is the femoral artery, which is located medially as compared to the vein. This is the saphenous nerve, and this is the nerve to vastus medialis, and there's also the superficial femoral artery, which is, as already mentioned here. So here we have the anterior aspect, which is the sartorius. Here we have the posterior aspect, which is the adductor longus, adductor magnus, and adductor brevis. And here laterally we have the vastus medialis muscle. So talking about the contents of the adductor canal, so femoral artery and femoral vein and saphenous nerve enter into the adductor canal through the superior foramen or superior opening, and then the saphenous nerve and artery and vein exit through the anterior foramen piercing the intermuscular septum. Femoral artery and vein exit via the inferior foramen through the adductor magnus. So saphenous nerve and artery and vein exit through the anterior foramen, whereas the femoral artery and vein exit through the inferior foramen. So that is one important thing to be noted here. So that was all about the adductor hiatus and adductor canal, in which we talked about the veins, arteries, and nerves, such as the saphenous nerve, the saphenous vein, the femoral artery, the femoral vein, and the femoral nerve, and all of the structures that were passing through this canal, including the neurovascular structures and the boundaries and the structure, including the sartorius forming the anterior boundary, the adductor muscles forming the posterior boundary, and the vastus medialis forming the lateral boundary. So I hope you learned something new out of it, and that was pretty much all about the anatomical components of the anteromedial aspect of the thigh. I hope you learned something new out of it. Thank you very much for watching sqadia.com.